to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Jeff DePass.
Here.
Dr. Turner. Jennifer Todd. Here. Dr. Lynn. Dr. Caddick, sorry. Here. Dr. Ross.
Here.
James McKenna.
Present.
Dr. Brucken.
Present.
Tony Watts. Present. Awesome.
Is there a motion for the approval of the minutes of July 20th? It's an action item. Need a motion?
So moved.
Is there a second?
I'll second.
There's a motion and a second. All those in favor?
Aye.
Opposed? The minutes are accepted. Financial report, Rhonda?
Okay, as it is in your packet, I did add that. Do you guys have any questions for me? Right after the minutes. It's gonna look like this. There.
It's not in color.
Sorry. Okay, you'll notice in the immunization grant, it'll show 610. It'll show 1,000. I had two of these actually. It'll show 1,000. One is in the negative, the 9,356.45, and then there's a positive up above that. That's because it goes from June and then July, and it's all in there. Okay. You'll see at the very bottom there's a negative $50. That's because I missed a gift card that they would not allow me to spend. So we'll get that cleaned up also. Other than that, we have spent down and kicked it out this year.
Any questions or concerns? Or
I want to bring up something. In 2020 and 2021, things really slowed down where we couldn't do programming like we had done before, especially using our health trust fund, which is what we pay for our Tire Amnesty program, and that's also the one where we sponsor an external program like the United Way's Mobile Market or the First Tee program or the Pause Project at Sarah Scott. It has a hefty carryover fund. And if there's a program that you think could benefit, even if it's incrementally, $12,000 or $15,000 a year or a one-time give, but if there's something that you could think about that would fit that category of a programming that would be a community-based program to help other people, help our community, let us know, because I'd like to see that not be such a large number.
do we lose it if we don't use it?
No,
Okay.
we don't.
Is the mobile market no longer a thing?
Right. We
Okay.
no longer do the mobile market, but we had sponsored it for 3 years. And because we usually do a 3-year commitment to external health programs. And again, because everything's slowed down, it has almost 2 years worth of funding in there. So,
Yeah. I know I would like to do something as far as food. I learned recently that our county is the worst in food security
yes,
and the state, which is horrible, right? So that would be my preference is if we could support whatever programs are out there to help with food insecurity.
absolutely.
Is it something that, is it enough money where we should even organize a little bit of kind of even focused maybe mini grants or something? I don't know if people know this money's sitting there either. Is
Well,
it health related?
The process is that we get the application from the State Department of Health at the end of August of each year, and the application's due by September the 30th. And so we have to lay out exactly if we, let's say the United Way's Mobile Market, it would be marked 25,000 for contractual services. And then we would have to have outcome and process objectives because then we have to send in the evaluation the next year. So there's a little bit more, even though many grants, they would have to show this is the assessed need, this is how we're going to do it, this is the timeline, outcome objectives, process, and how we would evaluate it. So as long as we could do that, then yes, I think it
Has
would be
anyone
doable.
come to the health department and asked about sponsoring anything?
No, It's-
Great park people.
well, the Ray Park people are doing the first tee program. We're bringing golf into all the elementary and middle schools through the PE teachers as a lifelong physical activity. But that's already counted into the sponsorship. So, but if there was, a program out there that you think could benefit, and it could also be for if there are, I don't think we really have an indigent clinic anymore, because we also sponsored St. Anne's, in the very beginning. That's the first external program we funded.
And we had the Pause Project, and medicines come and gone,
We
right?
did that for 3 years, and now we're doing the first tee.
What's the food kitchen by St. Anne's?
Catholic
Corner.
Charities, Catholic Charities.
Rise Hall?
Yes, right there, where they have a food bank and that, for a little, keep it going, East lunch there on the corner.
St. Anne's.
They have St. Anne's too. St. Benedict's has one also.
Right.
So there's some that already have been going and doing
Yeah.
very well, they could probably just use our.
Is the school backpack program still?
It still does.
It still goes, it's still going well, because I know with Dr. June's departure, that was his.
Mhm.
Well, then the meals are no longer free now, because COVID's over, so now they're having to pay, I don't know, just.
And one of the projects when I was on the United Way board that we did was a backpack project. And of course, everything runs its course, and I want to say that the school corporation really became involved and took it over, so it was then a duplication of service. So maybe that's something that we can look into is augmenting the backpack program.
When I spoke to, I'm sorry, when I spoke to Dr. Tunes about it, it was some staggering number, like 86% of kids were on free or reduced lunches. And of course, the lunches went free during COVID, and now it's back to having, so I'm sure that hasn't gone away, so just wondering about the funding of the backpack program moving forward.
I know another issue we run into in the hospital are people who are homeless, who are on insulin, and we're discharging them, and there's no place for them to refrigerate their insulin. I know we worked out something, I believe, with the Lighthouse Mission, where they were willing to store the insulin there, but I don't know if that's something, refrigerators in, like Middle North America or something like that. So people can not be readmitted and, their insulin safe.
One project or one thing that we have at Horizon Health in Paris, we have what's called Mobile Integrated Health, which is a nurse practitioner-based program that actually has paramedics that go on site to people when they're discharged. So they actually come and they follow up and they look at their medicine supplies and they make sure they can read their labels and they understand what's going on. It's a one-time visit and it's included with their hospital stay. Basically, there's no charge to the patient at all. So it doesn't matter if you're a payer source or anything like that, but I don't know if that's a possibility of piloting a program like that over here, just to start it up and see if it does any good. That's been
That
beneficial.
term community paramedicine has been around for 10 years or so, and we kind of got involved. Community paramedicine's been around nationwide for probably 20 years. We kind of dug into it a little bit about 10 years ago, and actually had a couple people in our Terrell Fire Department who became certified as a community paramedic. There was no funding source there. There was no way for them to charge for that service, so it kind of fizzled, but not everywhere. There's some communities in Indiana that it's happening, particularly in some of the rural areas where rural fire departments make very few calls. And so a lot of their day they're idle, and they would go make those calls, because they're taking people home and you know where they live and so forth. So the concept is there, the funding wasn't there, but, medication errors is a huge thing for readmission, of course. And that's always been a challenge for people. So I think there's some good ideas on the table, different projects for sure.
Can our health department do any programming through this, or is it too close to our clinics are not.
We don't have the staff. That's the critical part. We just do not have the staff. As a matter of fact, when the homebound program began with COVID, we relied on the township firehouses and firefighters to help us out to administer the vaccine. This was just so difficult. And we've worked with them before, we've partnered with them to help them get their Lucas devices, their chest compression devices for CPR. And so maybe that's something we can partner with them. But as far as us, and that's part of one of the cells of being able to have an outside entity contract with us. It's programming that we couldn't do on our own.
I just wonder what our clinic sees also as need, and if we're talking about partnering, so.
Darren, health officer's communication?
I have a whole lot, since the last meeting actually, so I think it was kind of status quo from my standpoint as far as interaction directly with the state. But I know we have some, at least one new employee who, so I'll leave that to Jenny and her part here in just a little bit, so. But again, as usual, wrapping up the year, always like to thank everybody for everything you've done all year for us, so thank you in total. So.
Under new business, there's the dates for our meetings for next year.
And I just want to throw out that, we usually meet the third Wednesday of every month. And you know that in April and October, we have to have our meetings over here because of early voting and the machines are up, voting machines are in the council chambers. I've reached out to voter registration, and in April, there isn't any way that we could move the date based on when the primary is. And so we would have to keep April the 19th in this room here. But if we moved the October meeting to October 4th, that means we could have it in the council chambers. So that's slightly different. That's not the third week, it's the first Wednesday, but I think that it's doable.
Okay.
And we'll heavily remind.
Under new business is the Indiana Governor's Public Health Commission report. That's what you have here, and we put it together for everyone. Through the Liver Center, we came across this report because we track a lot of state and federal programs. Dr. Box really ramrodded this program. You'll see that group of people there's about 15 people who serve on this commission for the governor. It's an outstanding report, so I'd encourage you all over the next few weeks to go through it. It shows Indiana being in a very bad situation in multiple areas. Just to highlight a few things, child and adolescent health findings. Indiana's ranked 29th in the nation for overall child well-being. We dropped down to 35th. School nurses funding. We can't fund enough school nurses. We have half what we're supposed to have. Behavioral health and school systems. They recommend a school counselor for every 250 students. We have one in 700. When you talk about EMS, was looked at in this. In Indiana, EMS runs have almost doubled since 2018. However, the number of ambulance and EMS providers has decreased at the same time. In 2020, there were 1,700 emergency ambulances. Now we're down to down over 2,000. Total EMS personnel has dropped from 24,000 to 23,000. Look at health funding, how we're funded compared to the rest of the nation. New Jersey funds $209 per person, and we fund $18 per person. We rank 49th in funding for public health. We're for government health expenditures, we rank 45th. America's health rankings, we're ranked as ranking 41st in the nation, which has dropped since 1980. It goes on and on. Life expectancy, we're 40th in the nation. And so I think it's great that somebody actually put together what we've all talked about here, that Indiana is not healthy. We don't fund public health. We're 45th to 49th on how much we fund public health. It's really worth reading. But what's also nice about it, Joey put together a second little report. This is what happened after all these challenging ideas. They had recommendations. And actually, this is what we should do to correct it. And my take when I went through this whole thing, the whole key was cash. It was funding. These programs are there, they're viable, we're underfunded, we're not paying enough money. It's about cash. The system is there, you can do more with it. But everything you work your way through. Paramedics not being paid enough, medical people not being paid enough, on our health department staff. To me, the major theme was funding. And so I think if everybody wants to kind of go through it, maybe the next meeting can kind of bring up some of the highlights and so forth and all that, but it's not a good report. It took a lot of guts for someone to sit down and actually put it to paper. What's interesting, this came out in August, and so we started looking at it in August. Since that time, I've spoken in person to 2 of our state representatives. They've never heard of it. Had lunch with Larry Bouchon a couple months, he'd never heard of this report. The head of our EMS Transcare, saw him at a meeting a few weeks ago, never heard of it. The report never got to our state legislator, Bob Heaton never saw it. I gave copies to all these people. So it's like, this wonderful report came out, it's almost like somebody, I don't want to say people want to hide it, but our state reps and state, John Ford had not seen it. Our state reps, state senators have never seen it. The head of Transcare, this is all about email. What were they doing with it? I still haven't seen much at all in the newspapers or anything about this report or on TV. So it kind of surprised me that all these elected officials have not gotten a copy of it. So we've been giving it to everybody we can see, and so forth like that. So I don't know if anything else about that, but it's very well done, but it's nobody's got it. Because the numbers are pretty appalling, and they're all about cash, in my opinion. The programs are there, they're not funded. No, we're not. So it's a good read, and we go the next few weeks, you'll be kind of shocked by the numbers, I think. I'm kind of disappointed in what we're doing really for the health of the
One of the first things that they identified on their timeline, the next 6 months is to do an external workforce assessment with all the local health departments. Well, we turned that in. It was very, very time consuming. So you had to list, every position, their gender, their age, their years of service. It was extremely detailed. It took a long time to do. And then after that, they'll do an internal workforce assessment. So, they laid out the next 6 months, and we'll see what happens.
Okay. Jody, do you want to comment on the adopted budget for 2023?
Yes, to follow up on that email that I sent you. I have to keep pinching myself and asking, after 25 years of working for county government, we didn't have a single cent cut from our budgets, all 4 budgets. That has never happened before. And I'm extremely grateful to our county council, and because there were other departments that had a lot of cuts to their budgets. But this is the first time that I can ever recall, not a dime, not a penny. Yeah, so the budgets that you received, the proposed budgets, those are the final budgets.
Well, we've had a pandemic. A million people have died. So I think the health department did a wonderful job of stepping up and doing all they could with all the resources they had. So never seen in our lifetime. Fees and ordinances. Amanda, do you want to speak to that?
So I sent you all the updated ordinance and highlighted in yellow the things that I wanted to add, change. Any questions on any of it? Amber came in and met with me. She sent me some little side notes and made some adjustments that way. And Jennifer Todd responded. Didn't know if anybody else had any other questions about maybe the fees that I want to increase. I didn't increase them a whole lot.
I wondered, because we are increasing them, so the business, or some of these businesses that they're gonna see that jump a little bit, and they're gonna wonder, why this happened. Just trying to remember some of the fees.
The last time that we did a fee increase was in 2006. So it's gonna be, but again, it's not that much of an increase.
I'm just wondering if, kind of some explanation, because you had very good rationale for that, just
Yeah.
saying, we're not really trying to overcharge you here, we're trying to
Right,
catch up.
And, with comparison to other like counties, similar in our size, that's where I kind of came up with our numbers, because the county that has the population right above us and then the one right below us, our fees were lower than theirs. So then I tried to make ours in line with what theirs was.
I had the opportunity to spend a few hours with Amanda doing restaurant inspections. I don't know if I talked about that last time or not. I really encourage anybody. She's tough. I love her.
I know.
It's great.
She looks sweet, but she'll get you.
Really,
You went to a tough one.
Well, we let them in, so that was the goal. But thank you for, really, spend a few hours just see what really goes on. It's really pretty impressive, actually, very impressive. And I appreciate, and also it's taking me to do the tattoo parlor inspections. That was very interesting too.
Yeah,
There's a lot of cash being spent in those
yeah,
places.
yes.
Wow, I didn't realize we had so many.
We've got an occupation for him in his retirement.
That's right.
18.
18,
That's a big, so, but thank you very much.
College town.
But they were very courteous to people, very professional, but this is the law.
Yeah.
This is what it's gonna be, and so that's the way it is. So,
And then in regards to the food establishment inspection that you went on, how many licensed food establishments do we have?
We have roughly 500 plus.
And then you think that our local ordinance says that we must inspect them twice a year, so there's a lot of time spent
And that
protecting
doesn't include our fairs and festivals with our temporary permits
farmers
either.
markets.
That's just our regular permits that we issue every year.
you guys are working hard. You see the list every, when you send it to us, there's a lot of work there. I appreciate it. So,
Something that was brought to my attention at the close of business day, and this is a good time that this is being brought into our meeting, is that the Vigo County Commissioners are in the process of updating and recodifying our ordinances, because some of them haven't been touched since the 1980s. And so it's a good time as they're updating county policy that we can look at updating ours also.
any other questions?
No.
Thank you. Thank you.
Do we have to vote on those changes, or they're just good to go?
No, this isn't an action item for tonight, but it will be on January, so we will never spring anything on you. It'll go for vote in January, and then it'll go to the county commissioners. And then if it goes through them, then they hold public hearings for it. I think it has to be published twice, and then it becomes code.
I think these are reasonable given inflation though. Inflation hasn't been pushed up for so long.
No, thank you.
So we'll go to program updates, vital records, please.
Hello, not much has changed. As you can see with the report, our birth and death go up and down monthly. We're still doing a request through the mail for birth and death. And we are gonna start having monthly meetings over a webinar with the state over questions that we may have and still have to put a ticket in or emailing them. Because the state, I believe, is very overwhelmed and does not have enough staff to help out with everything. So we're having monthly meetings that we can ask questions and see if we can get those answered that day. We have been helping out with homeless with birth records if they come in. They still do have to have an ID, but with the money situation, we go ahead and process it and give those out to them. Because with the cold weather coming, we do know that there's facilities out there, but they do have to have some type of ID and probably a birth record. So we have been helping out with that. We have been helping out with family members that do have children that are not the parents that they are raising, because on our birth records, we do not just give out to anybody. They have to be immediate family. So with that being said, if they do need it for school records, we do call the school, talk to the school and ask the school if we can email that to them or send that to them. So we're not directly putting it in hand of somebody that should not have it. So we worked with that a couple of times and that's went great. Like I said, the homeless, Brooke has done the report that you guys have asked for with the COVID and everything. Brooke is out this week with a family matter. I have been doing the death system. I have noticed just as of today, I did probably 4 or 5 death records with COVID on them. So we're still getting death records with COVID on them. Is there any other reports that you guys would like to see that we could try to pull for you guys on birth or death?
Were you able to answer, Dr.? Okay.
Yeah.
Yeah, I asked just for stats on overdose deaths and alcohol-related deaths.
I'm gonna start working on that probably tomorrow, and try to maybe have Robin and Brandy, and Brandy back there with Robin, she's my new full-time, this is her first time being in a meeting, Brandy, can you say hello? I will probably ask them to pull records, they're wanting from last year and maybe up till now, some records on drug and alcohol, and we're gonna see if we can get those for her. If you guys have any other records or stats you guys are maybe thinking about or want, we can try to pull something for you guys, if you just let us know. Might not get it that day, but I'm hoping to get hers by probably maybe tomorrow if they're not busy. We have been extremely busy today. I don't know why, but we have been extremely busy. We haven't really been busy with, when school started, we didn't get a lot of people asking for birth records. I don't know why, but we didn't. But I'm gonna try to get your report for you maybe by the end of the week or maybe next week.
And maybe we could capture suicides. Because when you're talking alcohol, deaths from alcohol, and from overdose.
Okay,
A
I'll
lot of
put,
times you're talking mental health issues, which also factors into suicide.
okay, I can put that on the report.
So
So
we
you
work
can do the
closely
number
with
on
the
that.
coroner's office on coroner cases.
Mhm.
It would be nice if you can isolate if anybody overdosed or died from fentanyl.
Okay, yes, I've seen a couple of those, yes.
You know.
Okay, we can put that on our monthly report too, if you guys would like that.
What does the ID look like that we give to people? Is it a photo ID?
The birth record,
Or, well, you're talking about the homeless and we're getting some kind of an ID.
if they have an idea, if they come in, they have to have at least a state ID or driver's license, and we do ask them, and we kind of ask them in a nice way. I always say, can I ask you a personal question? And they say yes, and I say, have you been arrested in Vigo County? And they say, yeah. We can always pull their mug shot.
I see.
And if they have their mug shot, we can always look, and we always have them sign it. We use that for an ID.
And worst case scenario, if they don't, we can use our ID.
As a friend, we
Try
truly
not to do that, but I've done it.
do not send anybody away.
That's perfect. Great.
Now with the family, as in the aunts and uncles we have ran into raising the children because the parents are not involved for whatever reason. I still have said, if it's for school, I do call the school. And the two I have called, they definitely have said, yes, I have to have that birth record, because we all know if they don't have it by a certain amount of time, they send out a letter stating if you don't have it in by this certain amount, we're going to kick the child out of school. So we do, I've emailed them. I said, if you'd like for me to email them or to send it by mail, I'm willing to do that. The two that I have done, they were willing to do the emails. And I've told the aunts, uncles, who's ever raising the children what we've done, and that's absolutely fine with them. But we can try to pull any record or anything that you guys are needing or want to see, just let us know. Come into the office, we'll let you go through records. And so that's all day.
Does the drive system, does that allow you to query by county and cause of death, type of thing? Can you get a report spun out of that or not?
No, we can do ours, what we call going in the back end, if they're not born or passed in Vigo County, we can look them up by name, and it will just vaguely give us some stuff what we need, but not the full. Any other questions?
Thank you.
Thank you.
Amanda, do you have more?
Well, of course.
Okay, I'm looking forward to it.
I gotta brag on my employees, you know?
Sure, I will.
So our food division continues to be busy. The girls are starting to slow down a little bit as far as the food inspections go for the year. They have been really busy with the events over the past 3 months, because we had, like you saw in my report, a slew of events to do. We've got a few more to wrap up the year. Septic division, they've been busy out in the field getting those septic permits issued and doing their on-site inspections due to this nice weather. That's helped a lot. Jennifer came in and saw us. I can't remember when that was.
The jail,
Yep, you went to the jail.
the old jail.
Yep, she got to go to the old jail for an inspection.
I've been the old jail.
that was interesting.
I'm glad they're getting a new job.
Yes.
We had several environmentalists go to our fall conference for the Indiana Environmental Health Association. They really enjoyed themselves, learned a lot, had some, did some networking, that kind of stuff. Amanda and Cheryl, went and took the lead, course, the 5-day course. After that, they have to pass 2 tests, and then they have to pass the state exam. And they pass it with flying colors. So we have 2 more lead risk assessors. And they've actually gotten to go on a few risk assessments, so those are starting to amp up. And then I just have to say, my staff continues to learn and cross-train daily. And they're enthusiastic, and I'm thinking they like public health, and I'm happy to have them.
There are 2 houses that she has in here that were red tagged. Do you want to tell them about the one?
Yeah, one of them had, 38 pigs?
It's a little house.
Like potbelly pigs. We're talking like 4 or 5 pigs. And code enforcement was there, building inspection was there. We tagged it, they got all the pigs out, they went to Winking Farms.
Pig rescue.
Pig rescue. So they rescued all the pigs. Then
Inside the house?
inside the house, inside and outside, Liberty House.
It's a shotgun house.
The tenant was a W amputee, so she was living amongst all that, couldn't really get to the bathroom, didn't have water.
Pirating electricity.
Yeah. So they rescued the pigs.
Who reported it?
Do what?
Who reported the neighbors?
It was code enforcement who called us, and then adult protective had to come in and building inspection, and once they got all the pigs out, they went ahead and condemned the home too, because it needs to be brought back up to code. And then the other home that we tagged was, adult protective case, another double amputee living in the home. And it was one that had feces and just not real good living conditions. So,
What you gonna do? Where they gonna leave?
well, Adult Protective Services works with them to find, places for them to go. They always
They own the
suggest
house?
Lighthouse, they always suggest Lighthouse Mission.
They own the house?
They do. They do. They thought they had it cleaned up, but it wasn't cleaned up. So, and I'll go out however many times I need to go out and take a look at it. But I'd still tell them no, it's a no. They can't live in it. So,
Start to go party when you're amputee.
I don't like doing it, but sometimes it's gotta be done.
Thanks, Amanda.
Thank you.
Vector control, Mike?
Don't trip. She threatened to do so before I got up. Well, we finished up our tar amnesty program. We collected over 6,000 tars, filled 6 trailers full. We kept busy with that, as well as our mosquitoes. And we sent in 7 bats for rabies testing. All came back negative. Today we sent in a possum. Tickled about that one, guys. Something different. Indiana finished up the year so far with, they tested over 152,000 mosquitoes. 244 came back positive for West Nile virus. We had 1 positive pool collected on 9/16. It was getting cool then, but we still collected a positive pool. Ended up with 39 counties with West Nile virus from the state of Indiana. 2 equine West Nile virus cases, 3 equine Eastern encephalitis cases, and 4 human cases. So we ended up with no deaths, which are good. But we didn't have any positive human here in Vigo County. But Illinois' numbers are a lot larger than what we had, which they always are. I always do this because Dr. Turner likes to hear the numbers.
I do.
They had over 2,400 positive pools with 42 counties with positive, 24 human cases, 5 human deaths, and 2 positive horse cases. So they had it a lot worse than what we did. A lot of ours I still blame, and I know I said this at the last board meeting, was weather. I prayed for rain, we got rain. North of us didn't get rain, so that's where most of the positive pools came from, was the northern part of the county, of the state, I mean. So Mother Nature helped us out. That's all I've got for you. Anybody got any questions?
Well, Mike, your 6,000 tires made an impact also.
Oh, yes,
Things that you
yes.
did, which is
Yeah.
a wonderful
That's
program.
a great
That's a
program.
huge part of it.
Yeah, we couldn't buy enough chemical to do a better job than removing those tars.
Sure.
Yeah,
Where did the tires go?
they go to a recycling facility. They cut them up and use them, shred them. They make playground material out of them,
Tracks,
bed mats, floor mats.
industrial.
Yeah.
That's good.
Yeah.
You just give it away, don't you get money for it?
And we have a license,
Can I ask you a question?
Uh-huh.
Let's
licensed
say
hauler.
if my mosquito has West Nile in my area, in my house area, how long does the mosquito travel? You know, like,
It depends on what species of mosquito that is. Each species of mosquito travels a different length.
how many miles do they travel?
So they will travel up to 20 miles depending on the species.
Wow.
But most of them are only gonna travel several hundred yards if you're talking Culex. But if you're talking the Aedes species, they are linked to West Nile virus as well, they will travel up to 20 miles to take a blood meal. So, what they do across the state line has an effect on our county as well as what we do has an effect on them.
Would 20 miles be Marshall?
Yeah, and what the other counties surrounding us, like Sullivan County had a positive human case this year.
So how many cases of West Nile infected mosquitoes before you declare that it's endemic in the area?
I don't know, Dr. Bruckman, how many would we have to have?
We wouldn't probably base it on the number of mosquitoes, it'd be human cases.
Human cases?
Yeah. Till it affects us, I don't think anybody.
Yeah, because positive pools and mosquitoes, I mean, we got them before where we've had up to 20, 22 positive pools in a year's time. But we didn't have a human case, so that's what makes the difference, is a human case.
And since West Nile first came under our radar in 2000, I think we've only had 1 human death
Yeah.
in Vigo County,
Adult?
adult.
I would say on the encephalitis panels that we do in the hospitals, we look for IgG and IgM. IgM is the antibodies that's acute, and IgG is convalescent. And I'm always shocked how many convalescent antibodies I find on people when they come through and we do them. Like, oh geez, you guys close to West Nile at some point. They're like, I've never been sick like that. Yeah, every so often, probably 5 or 10 a year anyway, the ones that I test for, severe headaches, encephalitis testing, and comes up positive, so.
Any questions?
Thank you, Mike. Appreciate it.
Good ladies.
Ms. Decker with the clinic, please.
Hello, everybody. Look at my first, thank you, Joan. Look at my first page that I provided to you, and you see that we saw 455 patients in clinic. And those were just our physicals, TB tests, reads, vaccine records, and copying. And I couldn't get this done absolutely by myself. It takes the whole staff to do this, and we have been busy these past 3 months. The next one over is the COVID-19. And as you'll see, we did 700 adults, and I just want to emphasize that that is just 2 full-time RNs working and a part-time RN, and we're doing that.
Vaccinations, so we're talking about
Say that again.
700 vaccinations that you did?
700 adult vaccinations for COVID and 135 pediatric. So Chelsea is sitting behind you, Dr. Lim, and she's one of them, and I'm the other one.
So where are your COVID clinic now? Where are they now? Just here
Yes,
in this building?
yes.
I mean, to administer the COVID vaccine.
Yeah.
There are other locations in Vigo County, at some of the pharmacies.
Some of the local pharmacies are giving.
It's very,
Some of the local pharmacies did not get their bivalent COVID vaccines, so they're not able to give. And then we've also seen a problem with pharmacies here in the area, especially the Walgreens, where they can't keep a pharmacist on staff. So the Walgreens down south, what I used to call the mall, down that way, they only have a pharmacist there 3 days a week. So I feel like we're seeing a lot of those people coming into the clinic because of the surrounding pharmacies are either not getting the vaccine, and I don't know what the reason is there for that, or they don't have a pharmacist that's able to give the COVID vaccine.
What kind of COVID testing are you using for the Board of Health? Just the one that we can buy from Walmart? What's the test kit that you use here?
We actually don't test here in the clinic. Ambulatory tests, and then both Union Hospital Convenient Cares test. They've been testing, I guess, quite a bit, and so sometimes those two Union Hospital Convenient Care will only test if you have symptoms.
Status of masking, 0, right? No more masking, no more masking.
No, man, just within the hospital.
We didn't mask for
Hospital-
2
hospital's
hours.
the only thing that's 2 hours.
Right,
That's what you probably do.
Yeah.
I got called
Yeah.
in Las Vegas when I went there and said 350 doctors,
Yeah.
Amazing, no masking,
So with the clinic as busy as it is, we've also started employee flu shots, so it's been a challenge.
Employee flu shots are on Tuesdays and Thursdays right now on a walk-in basis. All other vaccines that have been given to adults and children alike were 474 vaccines. So our COVID, we try to do one COVID vaccine every 10 minutes. For our appointments, we try to do all other vaccines, we try to do one every 15 minutes. So that keeps us hopping in there.
And 2 of our retired nurses, Jane Keys and Jerry Taylor, have came back to help us on a contractual basis. Even if it's for a few hours a day, it still helps alleviate the patient load.
And on top of that, we still do TB testing on Mondays, Wednesdays, and Fridays. And 148 tests were given for TB tests during the 3-month period. We do have one TB case that we're still following here in Vigo County. We have 4 LTBI cases that we're following. And we were able to close one of those LTBI cases. Lead cases. Lead, I say that with a sigh, don't I? Since that has changed for the state and they want that level to be below 3 now, we have seen a major increase in lead cases. So we had 21 lead tests done. Right now, we have 16 open cases. We usually get 1 lead case from state a day that we get in and have to work and look through. 7 new cases, and we were able to just close 1 of those cases. We've been busy with doing home testing and home assessments. We go out with Mandy and her girls to do that, try to make it all one fell swipe with that. So that takes up an awful lot of our time as well. I just want to show you animal bites. I know this is for July, August, and September, so you would expect, I think, some more. So the time before this, we had 0 animal bites, and now we were at 37. And I did look at that, and we had 8 cats, and all the rest were dog. Okay. The influenza type B, there was 1 positive here in the county already. The histoplasmosis, that was a new one for us for a while. We hadn't seen that for a while. And that case actually originated from someone going into the caves in southern Indiana. So nothing really from here. Let's see, the deficiency letters are now coming out from Vigo County School Corporation, so we're seeing quite a pickup in people coming in and needing their children's vaccinations, back up to date on that. We did go over to St. Mary of the Woods, 2 weeks ago, and I had told, Sister Barbara that we usually do not have a chance to leave the clinic at all, so if she had, I made her a deal, if she had 100 or more sisters and employees, that I would come and do that, and she rounded up 136 for me. So, we were able to get 136 of them, and they've sent really nice thank you notes to us, that are just sweet as pie. We do have a St. Mary of the Woods student with us this semester. She will graduate in May with her BSN from St. Mary of the Woods. Her name is Claire, and she is delightful, and she is able to help us on the days that she is here. So we welcome her every time we see her. Let's talk about, we still go to Jabalt. We did have a mandatory meeting with Terry Lyles. She is with the state, and her title is Regional Quality Management and Education Consultant. She will be checking in on us for a year. This is a mandatory program that every local health department in Indiana must complete. And so they're mainly looking at immunization records and then our completion rates. Just because of COVID being here for the last 2 years, of course, your vaccination rates are not quite where they need to be. So state is pushing that, and that's what this is mainly looking at, is those kids right there. Monkeypox, we haven't seen any cases of monkeypox here in Vigo County. I was able to take the names from the dashboard that were there and call the people who had asked to sign up for a monkeypox Jynneos vaccine. So we have done that, and I am ready to give, it's a series of 2, separated by 28 days. So they're ready to come back next week and start their number 2 vaccines for us. And then we'll have to see from there. The state had come in and conducted a strike team on Fridays in the month of September. And then they also did at Zimars from 8 to midnight, 2 different Friday nights as well. And they vaccinated, I haven't gotten a good read on them, but they're telling me somewhere around 85 to 100. With that, the only issue that has arisen from that is that there wasn't a long-term plan made with those people. So their number 2s are now coming due, and there is no plan in place for them to get those. State is running very low on Jynneos vaccine, so I was only able today to get my hands on 5 vials, and that will cover the people that we vaccinated here locally. But for those people who are vaccinated with the state strike team, we've got to somehow find a way for them to get vaccinated with their second one.
And one of the questions I've asked Linda, and you may know this, or Dr. Turner, or anybody, like when we went into the jail and did the incarcerated population, we gave them the Hep A vaccine, we knew what the efficacy rate was for 1 dose, even though that's a 2-dose series. Does anyone know what the efficacy rate is for 1 dose of monkeypox?
I haven't seen any in the literature, or
Okay.
it's sort of kind of died off. It's a small population of people.
Yep.
You know.
You give it to those who have HIV, right?
We can,
Who you select those who give the monkeypox? What are the?
high risk individuals,
Yeah.
is that what you're
What are
wanting
they?
to know? So, anyone who has sexual contact with the same sex is at high risk. HIV is at high risk. Some that are traveling overseas are at high risk for it as well. So that's who we have mainly given to.
But it's not required by job, by
No.
travel.
No.
And Dr. Turner, did you say that you've seen an uptick of RSV?
Yes.
Lots of RSVs. Well, Jimmy knows, probably, go ahead, Jimmy.
No, I mean, I just would concur.
Okay,
We've had a lot in
concur.
the ER,
But
yes.
it's not that bad.
That's
You
fine.
know, over the year, I've seen different strains and so forth, and you can get it the next year. You're not immune from it. But I called up to Peds last week and nobody been to Riley, nobody's on a ventilator. It's mostly 24 hours observation, send them home. Lots of strep too, it seems like, but actually they're not working in that really sick, scary. And the other point is, we have nothing to offer the children. There's no medicine that really helps them. So, it's a frightening thing, it's a real thing. But, I just haven't seen children that sick.
Yeah, that's share a lot of concern about just the shift in seasonality from RSV that occurred during COVID. And it's all the same type of thing, the same with influenza. We're starting this, the ILI line right now for state of Indiana, it's just now ticking up too. So weather's just now changing, got cold, now it's gonna be 70 again this weekend and back in the 40s the following weeks. I wonder what's gonna happen with the seasonality. We're gonna see a permanent shift. We had RSV in May because of COVID. I don't know if that's diluted the pool or just hypothetical, who knows, but.
Well, flu A's out there,
Sure.
and then we're talking about another variant of COVID.
Yes,
I mean, it's the nature of viruses,
right,
so we
yes,
just have to be vigilant.
yes. I've got couple of former students that work over at Riley Children's Hospital that I keep in touch with. And last Wednesday, they were almost put on diversion because they were full with RSV over there, so, yeah, it's out there.
Yeah, I know regional actually had a COVID case that was primary pulmonary parenchymal, which hadn't seen for a year. And looked ominous from what it looked like in 2020. But Jesus, yeah, I don't know where that came from, but vented in the whole rectochrome. So I don't know if they survived yet or not, but.
With the dog bites, do we know, were they stray dogs or pets? Do we have that data?
We do have that data, and if you want me to
I just
go back and look at, yeah, some are stray,
Yeah.
and some are their pets.
They're interesting to read.
Very interesting.
They really are. Sometimes they'll draw what the cat looked like, because the person who got bit fills out one side of it, and the provider fills out the other, but like the dog's eyes met mine and looked at my ham sandwich and.
Yeah.
Seriously.
I just know anecdotally from running, it does seem like
Yes.
there are more stray dogs out, so.
Yes. Yeah. Dr. Brecken, you have a question?
I was just gonna ask, I'm just kind of curious, as the school corporation, do you have any kind of insight? What is that gonna look like as far as immunization deficiencies? Because we have all these kids homeschooled and partly homeschooled with COVID and everything else. Is they getting any, I haven't got anything, has anybody like received anything like, hey, this is gonna be really bad as far as our deficiencies are gonna go up?
So I've talked with Elaney, and they're just as of last Tuesday, they had just started looking through the records. So there wasn't really enough looking through it yet to decide what it's going to look like. I would love to mini grant, get another person on board, something, and even be able to, in the spring, go out to a couple of schools and be able to catch them up.
It's kind of what I'm kind of in my own brain working through the same thing about the money that we have around. We had the Vaccinate Before You Graduate program. We went on site, and if we're going to be looking at a 40% deficiency rate and we can't capture those kids, mobile vaccination, fits in line with the state's recommendations, obviously, the push to vaccinate these kids. We may have to go in the community to get it done, so.
I can give you the Vigo County rate if I can pull it from the office, yeah.
And one of the deliverables for our immunization grant is to do school-based clinics to get the immunization rates up. But when we see what our immunization rates are, I didn't realize this until Elaine Miller pointed it out. They are the end date, beginning and end date. The end date is before the finality of the exclusion letter. She said, so when you get our data, we had a lot of kids vaccinated in the interim time. It doesn't capture those that in August that go to school that aren't vaccinated until whenever the last day of the exclusion. But it's like it's not a true picture.
Right.
Because by December, it could be totally different than it was with the
Yes.
numbers that the state puts out as our whole year thing, which would be like September. But we still know they're low.
They allow unvaccinated students to go to school, right? Public school.
Yes, right now. And then they're going through the data and sending out the notices to parents that their children is either up to date or needs to get those vaccinations.
If they don't comply, then what happens? Is it?
Well, there's an exclusion point at some point in time that they decide in the school corporation where they exclude those students from school if they don't comply and get their vaccinations.
What's the rule now? What's the rule, standing rule, right? If you are unvaccinated, you cannot go to school?
If you're not optimally vaccinated, you have until a certain date that's established by the school district to get those vaccines. And after that point, the child is excluded. It cannot come to school.
When the state changed the guidelines on lead,
Yes.
so does that mean they gave us extra staff to meet those guidelines? What? You know what I mean? That's the classic government.
I know.
New guidelines, but not the staff to do it.
Classic.
What? So I just wondered,
Classic. I mean, I'll just give you an example, Dr. Turner. I was out the other day with staff doing a home visit for lead. And I don't take my phone in, of course. And the one who's responsible for monkeypox only at state level thought it was very urgent that she talked to me right then. So she tried my phone, she tried my email, and she tried text and couldn't get it. So then she went to Joni and did the same thing with her because she needed me right then. Right then. So I got back and I called her and she said, the first thing she said to me was, "Where have you been?"
Really?
"I haven't been able to get a hold of you." "Yeah, where have you been?" And I said, "I've been out doing an assessment at a house that has an elevated lead level at it." "Oh, well, I needed to get a hold of you." And it was no urgent message at all.
Sure.
But yeah, they don't provide any extra for us, but they expect us to be at their beck and call at all times.
That's kind of the history of government, though.
Yeah.
Yes.
Unfunded mandates. You give
Yes.
a mandate, but no funding to go with it.
Uh-huh.
Why, who wants 148 TB tests? What, is this students or what? People going into healthcare careers? I thought it was like an odd
Healthcare
number.
careers,
Correctional officers.
correctional officers,
Yeah, they're not-
community
they're
corrections.
not
We
doing
see
that.
a lot from daycare, doctor.
Okay.
Daycare
Just seemed like
or bridges, ARC, those types of
I was really
places.
surprised with the big numbers.
It ought to be self-defeating. At some point, the number needed to treat or to detect, it ought to wipe it out.
Yeah.
Right.
And then you gotta check them too, a couple days later.
Yes.
It's a busy thing.
Yes, yes, absolutely.
You guys are humble.
We are. All of us are. Yeah, yeah. Thank you.
Thank you.
If you ever have any questions, don't hesitate to holler.
Health education, Shelby?
All right, well, hello, everyone. I am Shelby, and I'm the new public health educator and media coordinator for Vigo County. So I just was crazy enough to come back to Indiana from Florida. Kind of regretting that now. It's a little cold. But down there, I have my bachelor's in public health from Florida Gulf Coast University. And I have some community health experience with Blue Zones Project. So we're taking some of those best practices and transcribing them to Vigo County and implementing them. Actually, in November, we're going to start what we're calling Maintain, Don't Gain. It's a 10-week program throughout the holidays. So we're splitting up the department in each little division, and we're going to see who's going to maintain, gain, or lose weight. And at the end, we'll see what kind of prize there may be. But it's kind of like, it's fun to include more passive movement, so it's not a little alarm going off when you're watching, oh, you gotta go to the gym now for an hour. So walking meetings, things like that. So if we could do this in a walking setting or standing up, we used to do those in our meetings too, so we have a stand break. So I'm also working on training, so that's CPR training, as well as crisis and emergency risk communication. So I'm doing that right now, and I've been doing that since I've been hired 3 weeks ago. Vigo County is going to be represented at the local public health leadership symposium next week in Indy. So myself and a few colleagues are going to be going up there. And in the future, for some of the programs, we're going to be doing nutrition education within our school systems, as well as continuing some hand washing techniques throughout the schools as well. and the CPR and AED for all of the town workers.
Want to tell a little bit about some of the projects you did for the Blue Zones?
Yeah, so I was with Blue Zones, I interned with them my last semester of college, and then I came on as a retail food specialist, so I worked a lot within the food industry. So food insecurity, we work with Means Database, it's an online platform. We were actually able to rescue and give back to the community over 110,000 pounds of food, all through the mobile site. So they could go on, whether it was a food pantry or a grocery store or a restaurant, they would post it and someone could claim it, and then between the two, they would organize how to pick up, drop off, and all of that. Other than that, we would work with a lot of healthy eating choices. So nutrition food labels, a lot of people thought what they were eating healthy wasn't actually healthy. So even in the school system, we would go in and teach kids how much sugar is in some of the drinks. And actually, the kids were more imposing these healthy habits on their adults, their parents, than I would have had. Because they would go home and they'd be like, Mom, Dad, you know how much sugar is in that can of pop or that sweet tea? And then, they felt bad that their kids were having healthier decisions than they were. So we have the multiple tier level. You have the bottom, but you also have the top. And eventually it gets to the center and everyone is implemented and affected somehow.
So you're zeroing on school first education?
Yes, I am going to be starting schools with some of their programs. We already had the hand washing before, so we're gonna keep doing that. As well as they were the mobile buses, weren't they, or like outside type. And I'm actually meeting with Holly next week on Thursday for the school district.
She's met with Purdue Extension staff.
Purdue Extension, I've already had a meeting with
Why don't you start
The
with
chamber.
the cafeteria of school, then unhealthy food?
the unhealthy foods, and maybe we could even do some of the partnership that you guys were mentioning earlier of using some of that money for the free lunch program.
And maybe just identifying then that, hey, what you're serving is so many sugar and that might help.
We have plenty of resources in that little office over there from my plate.
It's really
Any other
nice.
questions, concerns?
Welcome aboard.
Thank you. Great job, thank you. Appreciate
My
it.
question is, what you doing in here coming from Florida?
Main reason is family, but it was too hot.
I thought it's a guy.
Yes.
Is there any citizens input this evening? Nobody loves this? What, our next board meeting will be January 18th. We'll entertain a motion for adjournment. Second. Moved and seconded, all in favor?
Aye.
Any opposed?
Won't meet until after the holidays, so happy holidays, everyone.
We'll send you out an invitation to our Christmas party, because nobody parties like the health department does.
Sort of.
Hardly either.
Shaman, I talked to you about, I'm gonna invite you.